Okay, so we're going to do a little overview of the finals review. And I have been instructed to keep it short and sweet, so I'm going to try to keep it short and sweet. So let's see what we got. Whoops, I forgot to take myself off. I don't want to watch me the whole time, I know. I wouldn't. Okay, now we can go to PowerPoint. I like to do these in PowerPoint so I can divide them up and kind of look at them as we go. Emergency care review. Everybody knows how to do your CPR, what you should do first. It's also in your book. So your CPR, just know how to initiate it. You know, you're not going to go over there and just start doing chest compressions, right? You're going to check for responsiveness. And so the order that you would do CPR, be sure you know that. Look over your heat exposure to make sure that you know which patients have heat exhaustion versus heat stroke, and which patients you should see first that have been exposed to heat. Make sure you know your emergent, urgent, non-urgent categories. So there's a little box in there in your book you need to look at. Communication and report to the floor. You need to know what all you need to tell the floor nurse when you give report from the ER. A lot of times it's short and sweet and not near enough. So you want to make sure that you give them all the information that they need. So make sure to be able to choose things that you need to give to the patient. Safety in the ER. There's a column in there that tells you about how to keep your patients safe in the ER, such as falling off stretchers, falling in the floor, getting up when they've been medicated and they shouldn't be. So those patients that have fall risk, you need to be sure and identify them when they're down in your ER. Know how to treat heat exhaustion before they come to the hospital, such as spraying them down with water and giving them cold drinks and giving them electrolytes. Your snake bite complications, be sure to look over what pit vipers complications that you're going to be seeing, such as the tissue necrosis, the swelling, renal failure, hypovolemic shock, be all kinds of things. So be sure you look that over. Safety of your victim. If your patient is in an area where their safety is a concern, what do you need to do about that? And then, of course, your stages of shock. We didn't go over, but the hypovolemic shock was one of the ones that we went over the most, and it has several stages in it, so be sure you know those stages of shock. You know, like you have a stage, the compensatory stage or the non-progressive stage of shock. You know, what are you going to see in that? What are the symptoms? And then when you're a student at the hospital, what would be one of your roles there? Okay, we're on to the next one. The musculoskeletal peds review doesn't look like a whole lot, but remember what we said about treating hypercalcemia with the children and how they develop it because of that negative nitrogen balance that they get, and that way the best way to treat it is to be sure that we hydrate our patients. And y'all missed this on on your exam, so I'm putting it back on here because I think it's very important that you know the importance of hydrating an immobilized child to prevent hypercalcemia, and not to be giving them calcium such as milk and cheeses and things that have a lot of calcium in it. DDD, developmental dysplasia of the hip. Know your treatment, know your nursing teaching. How do we treat it? From birth to 6 months, we put them in the pallet harness. What do we teach them? So be sure to look at that. You're going to have several questions on management of care, ranges of options to do first. That also goes with who to see first, who to assign to who. So you're going to have to know the disorders, which ones are life-threatening and which ones are not so much life-threatening, so that you would know who to see first and who to assign. Your scoliosis, be sure you know how to diagnose the degrees. If they're less than so many degrees, they're only watched. If they're over so many degrees, they have to be treated in a brace. If they get over 45 degrees, they have to have surgery. So be sure and look at those and the treatment for each one of those. Felt kind of weird doing the skin integrity and burns review. because you haven't had skin integrity and burns yet. So we'll just kind of hope that you uh, listen to the video when we do the lecture. Be sure you know what those risk factors are for pressure ulcers. You know, you use the Braden scale. There's so many people that are at risk. What people are at risk? Why are they at risk? What are sort of things that there's a box in the book. Third spacing in burn victims. This happens in the resuscitative stage or phase 1 of burns, where you have the third spacing where the fluid goes out of the vascular space and into the interstitial spaces. What type of electrical imbalances does this occurs during this third spacing, which would be hypernatremia or hyperkalemia and hyponatremia. What about resuscitation time? It's in your book, tells you when you should start your fluid therapy, how to figure out your amount of fluids, and I'm going to be going over that in the class. Usually you figure out 4 milliliters per kilogram times percentage of burn equals the 24-hour intake. The first half of the fluid intake, and it's usually a large amount. Usually you'll be seeing 10,000 milliliters is what you need to be going through. So you'd be given 5,000 milliliters is half of that. You would give that in the first 8 hours. Well, if the first 8 hours, if the burn occurred 2 hours before you started your IV, you have to run the rate at a 6-hour rate, because 2 hours have done passed since the time of burn, and that's when you start figuring out your percentage burns, or your fluid volume of the burns is from time of injury, not at time that they arrive at the hospital to get resuscitative fluids. Know about your urinary output in relationship to intake, how important it is. I don't know how many times I've stressed that urinary output is one of your major assessment issues that you need to do when you are concerned about fluid shifts. Look in your box about sulfadiazine, and make sure that you know what you can and cannot do with the silvasadine, or this, which is actually silvadine, which I can say silvadine. I cannot hardly say that word. It's really a hard word to say. So you want to be sure that that you know what you can and cannot do. You really should not put silvadine on a wound that's covered with eschar, because it's not going to do any good. You want that eschar to break down. You don't want to kill the bacteria. So you want to be sure to know that. You're going to have to know which patients need more care than others to be able to assign your patients. Calories per kilogram, you should have 30 to 35 calories per kilogram per day. Most burn victims should have at least 5,000 calories a day. So I'm going to go burn the end of my little finger so I can eat 5,000 calories today and not feel bad about it, because I could do it. Care plan for high-risk pressure ulcers. How are you going to take care of your patient that has pressure ulcers? What kind of plan are you going to make to prevent pressure ulcers? Know about your negative wound therapy, which most of us call wound vac, and how where it's contraindicated at. You know, when you should use it, when you should not use it. And then know about your burn victims that are going to be at risk for respiratory issues, like those that have been burned in an enclosed house. They may have some inhalation issues. Those who have had inhaled steam. Those who have eschar around their chest. Be sure you know those things. Those puts those patients at risk. So if you listen to my lecture and you study really hard for that, you'll be prepared for this part of the test for finals, because you're going to have it right after. So I think that's a good deal. All right. Study hard. I guess that's all I got to say.